Daily injections provide the ultimate stability, so it can be necessitated for some patients starting treatment. But they can also absolutely be optimal for everyone if people are willing to do them. It is recommended that for hormone replacement therapy in men, testosterone cypionate is administered via a 1 ml injection every 2 weeks. Now, this will probably lead to...
Okay, everyone, welcome back to another episode of my solo-sodes here for Victory Men's Health. I love talking about daily injections for a number of reasons. That's not sarcasm. I genuinely like talking about daily injections because daily injections represent the opportunity for people to go the extra mile with their treatment. And daily injections are something that I would also argue that for men who are not able to or don't want to use cream for like a legitimate reason, if one of those potentially exists, maybe that's a topic for another video, but daily injections can be necessitated for some patients starting treatment. But they can also absolutely be optimal for everyone if people are willing to do them. And to understand the whole point of daily injections, or the discussion point more so of daily injections, what we're really looking at here is trying to understand what the pharmacodynamics are of testosterone cypionate, for most people listening, or also enanthate, which are virtually the same. Enanthate and cypionate are kind of like Coke and Pepsi. People have a preference, they're kind of different, but they're the same thing at the end of the day. I mean, everyone knows Pepsi Max tastes better than Coke Zero. And in this context, I would say that cypionate is the Pepsi Max in the scenario, because cypionate does have a slightly longer half-life. And even though we're talking about the difference in hours of half-lives for a compound that has a half-life of arguably, debatably, depending on the study, anywhere between 5 to 10 days, it is a bit of a negligible difference. But if we have the option between the two, that is going to be the superior one. In the United States, and Victory Men's Health, we're talking about cypionate. Through my clinic in Australia, we primarily use cypionate, so I'm going to talk about cypionate from here on out. In the medical guidelines internationally, it is recommended that for hormone replacement therapy in men, testosterone cypionate is administered via a 1 ml injection every 2 weeks. Now, this will probably lead to people having a pretty good few days, a pretty average maybe week, and then probably a pretty terrible few days until the next shot rolls around, with all kinds of inconsistent side effects: water retention, moodiness, nipple sensitivity, exacerbated emotions, sprinkled in throughout the 2 weeks just for good measure. And the problem that comes with a protocol like this is not just the peak and the trough being too high and too low respectively, but also the fact that the levels are moving more than they should. And it's the movement that I believe causes more of the issue than the peak and the trough, which is why I want to talk about daily injections. Men do not do well. Actually, I would argue that humans don't do particularly well with fluctuating hormones over the weeks, but men particularly don't do well with it because we're not designed for it, or we haven't evolved for it, depending on what people believe. Men have a daily hormonal rhythm. And when it comes to testosterone replacement therapy, myself and many other colleagues who I work with, regardless of what people come up with mechanistic theory and nonsense all over Reddit and YouTube and whatever other forum people are on these days, the primary goal of administration frequency is stability. Stability is king on TRT. Stability is king. Stability is king. We are aiming for stability. We are aiming for not just stability, we are aiming for long-term stability. This is where the benefits come from. The benefits on TRT come from when you get your dose right and you've been on that stable dose for a while. And I don't mean weeks, I mean months and years. That's where the benefit comes from, is stability. We do well with hormone stability. Daily injections provide the ultimate stability. So if we imagine that, if we go back to our example of our shot every 2 weeks, they say that testosterone cypionate has a half-life of 5 to 10 days. And it seems to be very varied based on the study. And I would hypothesize that this comes from the fact that the studies are done with different needles at different injection depths in different muscle bellies. And this doesn't impact the fact that you still absorb 200 milligrams of testosterone, but it does seem to change the distribution of the medication. And probably to do with the fact that different muscle sites have different amounts of blood flow. I mean, it seems to change it a little bit, which is why we fluctuate in terms of the half-life estimation, but let's just call it a week. I think most people agree that we can call it about a week.
If you've just started TRT, it is completely normal to feel overwhelmed and confused. There's a lot of new territory to cover, and there is a lot of conflicting information. I wrote TRT 101 so that you can have everything that you need to know in an instruction manual in one place that you can refer back to, that you can have all the questions answered before they even come up. TRT 101 is my best practice approach for TRT from start to finish, and it contains everything that you need to avoid all the challenges and pitfalls that I've seen come up in my clients over the last 5 years. You can check it out via the link below.
Some people seem to think that half-life means that if something has a half-life of, let's say, I don't know, let's use caffeine as an example, 8 hours. I don't know about you, but if I drink a cup of coffee now, I'm not going to be on a even kind of caffeine increase for 4 hours and then an even drop off for 4 hours. There's a peak and then there's a crash. But the caffeine still has a half-life of 8 hours. But you're not getting 50% of the benefits of caffeine still at 8 hours for the effects that we're trying to achieve, right? I mean, I don't think anyone is. And if you are, then you're an exception to the rule, because most of us are not. So testosterone is not evenly distributed over the half-life. And I think people confuse things like mean resonance time and area under the curve with something like a half-life. But we know very well that testosterone cypionate spikes on day 1 and for some people on day 2. But it has a very pronounced spike in day 1 and 2 and then a very sharp drop-off after that. Very, very sharp. And this is why twice-a-week injections have to be the minimum for testosterone cypionate protocols. Because otherwise we are creating too much of a peak and a trough. But not only are we creating too much of a peak and a trough, but we are spending too long per week with lower than therapeutic testosterone levels. But the levels are still moving around in the serum quite a bit. And some people seem to do okay with that. Maybe they metabolize the ester a bit slower based on genetics, who knows. But a lot of guys do very well on 3 injections per week or every other day, if people prefer to do that schedule. But the step above that is going for daily injection. And given that for a lot of people, I would argue the majority of people, testosterone spikes on day 1 of injection, doing a daily injection makes sense for stability. And I think there's a split in the cohort of people. There's people that when you go beyond, let's say, 3 injections a week or 3.5 injections per week, if you're doing every other day, they'll say, well, the only difference I really noticed subjectively is the fact that I'm just, sticking myself with a needle twice the amount of time. And people don't really notice the difference. And if you fall into that category, I think that unless you're a masochist, it makes sense to just do 3 or 3.5 injections per week. That makes sense. If there's no discernible reward for doing twice the amount of work, it seems kind of foolish. But there is a substantial cohort of men who, when they do daily injections, they feel considerably better. And this may be to do with suboptimal insulin sensitivity, and they are benefiting more from stability for preventing side effects. But I also think that there are a decent amount of men in this cohort who just metabolize the ester a little bit quicker. And even doing every other day injections does result in a pretty decent amount of maneuvering of serum levels over a weekly period. And some guys seem to do okay with that and some guys don't. So I come back to the saying that I've had for about the last year, which I think I'm going to continue with, which is that everyone should inject as often as they will. So if you're someone who is super busy, you do maybe do shift work and got young kids and everything's all over the place, you might go, look, twice a week injections is already pushing it. I have to put an alarm in my phone. Cool. Twice a week injections. Much better than being hypergonadal. Or maybe cream would be a better option depending on your schedule. 100%. Cream allows us to have even more frequent administration. I would say for about equal stability to daily injections, because the half-life's short of it, we're putting it on twice a day. But from a protocol, convenience, career, family standpoint, that might not work for some people. And that's okay. That's a legitimate reason not to do it. So for some people, injections are going to be the only option, and twice a week is the only thing they're going to be able to do. But for someone who's working, a 9-to-5 office job, stable, lifestyle, consistent routine, maybe very routine oriented, daily injections is an option for guys to really optimize their protocol as long as you're sticking to the prescribed weekly dose. Because although daily injections may not be needed by everyone,
I would say that almost everyone could benefit from it. It's just whether the work is worth the effort. And if you're thriving and you're doing well, if it ain't broke, don't fix it. But if you do feel that there are fluctuations in energy levels and mood, and you're going, hey, is this placebo or is this actually a thing? Am I actually feeling better on days I do my shot than the days I don't do my shot? Or are you noticing and going, hey, every night after I do my injection, I sleep really well, wake up full of energy, but then, if I'm doing 2 shots a week, by the time my next injection rolls around, I'm kind of hanging out for it. Daily injections could be something to look at. And especially if you're starting TRT and your health's a little bit off. Maybe your insulin sensitivity is not good. Maybe you're a little bit overweight. Maybe you haven't been doing enough cardio. Maybe you've been drinking a little bit too much alcohol. Or maybe it's a little bit of all three. Daily injections are not a panacea to prevent side effects, but daily injections will allow for more stability and more even levels, and for a lot of guys will prevent side effects from occurring in the first place. And sometimes it's actually worth sitting down with your practitioner or provider and going, hey, I know I've got some work to do here with, getting myself on track, dropping a bit of body fat, cleaning up the diet, dropping the alcohol, giving the liver a rest. And maybe you'd be willing to do daily injections for the 6 months until you get all that stuff together. That would probably keep your blood pressure down. That would probably keep you more even keel and prevent it from having side effects. Do you need to do it? Probably not. You could probably get away with 3 injections a week or every other day. But could you benefit from doing daily? Absolutely. So if you're willing to do daily intramuscular shots with a little needle into the shoulder every day, even for the first 6 to 12 months of your treatment, that could be the thing where if you're really wanting to avoid any risk of side effects and you're really wanting to at least minimize anything potentially going wrong, inject more often. Inject as often as you will. And if daily administration sounds like something you're really interested in, but you're like, I don't know if I could do the needles every day, that sounds like a lot, then that's when you want to look at the topical cream, the trans-scrotal 20% cream. Both of these options are offered by Victory Men's Health. And both of these options, I believe, should be discussed with any reputable TRT clinic. The option of going, hey, there are 2 really good effective options here for treatment, and maybe one is better suited towards your preferences or better suited towards your health. And that's a conversation that every good TRT provider should be having with every patient they see. And I often get guys who are a bit confused and they're like, I don't know whether I should start with injections or with cream. And the good thing is that you don't have to permanently lock into one for the rest of your life. You can get dialed in on one and go, maybe I'd like to see what the other one's like, just to see if I prefer this. If you're going to do it for your whole life, I mean, going back to the analogy, and again, I don't recommend people drink a bunch of diet soda, but if you're really into drinking diet cola, and you really love diet cola, and you drink diet cola every day, and you drink, Coke Zero every day, maybe it's worth trying Pepsi Max, just to see if that's a better option. If you're going to drink one every day, I mean, you wouldn't want that one to be on the shelf looking at you every day, and you just never touch it, and then found out you much preferred it. And the testosterone routes of administration are the same. It's so important to stick with one for at least the first 6 to 12 months to get dialed in and to optimize serum testosterone levels to resolve the negative symptoms of hypogonadism and to have those symptoms stably resolved and in remission. That's priority number 1. But once that is done, if you're curious about the cream or you're curious about the injections, now that you've got your set point that you can refer back to, your provider can absolutely trial one of these options for you for 6 months, and you might prefer it. Or you might dislike it and go back to where you were previously. But either way, now you know and go, okay, this is the treatment that I'm going to do for the rest of my life, and I'm happy with it, and I know this is the best option for me. So consider daily injections if you feel like your protocol is uneven, or if you're starting TRT and daily injections are something that that you're willing to do, it is something that is worth looking at and discussing with your provider. So I hope that helped, and I will see you guys on the next one.
What we're going to be going through today is the basics. And I think it's very important to revisit the basics periodically, because if we look back 5 years ago and even 10 years ago, what was considered best practice then may not be considered, and from 10 years ago definitely is not considered best practice now. A lot of the content that I make is talking about more high-level troubleshooting cases, but most people, actually I would argue everyone, at one point or